Hello, welcome to my channel. Before moving on to the video, if you liked the video, like the video, and subscribe to my channel. Thank you from now. What is hay fever? Hay fever is a typical condition that influences near 18 million Americans, as per the Communities for Infectious Prevention and Counteraction, CDC trusted source. Otherwise called hypersensitive rhinitis or nasal sensitivities, hay fever can be occasional, lasting, extended, or word-related. Rhinitis alludes to disturbance or aggravation of the nose. Side effects generally include runny nose, nasal clog, sniffling, watery, red, or bothersome eyes, hacking, bothersome throat or top of the mouth, postnasal dribble, bothersome nose, sinus tension and agony, bothersome skin. Side effects might turn out to be long haul, assuming that hay fever is untreated. How in all actuality do hay fever side effects vary from different circumstances? Albeit the side effects of hay fever and the side effects of a virus can feel comparable, the greatest contrast is that a virus will cause a fever and body throbs. Medicines for both condition are likewise totally different. Difference. Timing. Hay fever begins immediately after exposure to an allergen. Colds begin 1 to 3 days after exposure to a virus. Duration. Hay fever lasts for as long as you are exposed to the allergens, typically several weeks. Colds usually last just 3 to 7 days. Symptoms. Hay fever produces a runny nose with a thin, watery discharge. Colds cause a runny nose with thicker discharge that may be yellow in color. Fever. Hay fever does not cause a fever. Colds typically cause a low-grade fever. Different circumstances with side effects like hay fever. Head cold. Infective rhinitis incorporates upper respiratory lot disease. Aggravation rhinitis, response to actual changes or synthetic substances. Sinusitis. Not at all like hay fever, these circumstances can likewise cause fever. How in all actuality do hay fever side effects vary from different circumstances? Albeit the side effects of hay fever and the side effects of a virus can feel comparable, the greatest contrast is that a virus will cause a fever and body throbs. Medicines for both condition are likewise totally different. Difference. Timing. Hay fever begins immediately after exposure to an allergen. Colds begin 1 to 3 days after exposure to a virus. Duration. Hay fever lasts for as long as you are exposed to the allergens, typically several weeks. Colds usually last just 3 to 7 days. Symptoms. Hay fever produces a runny nose with a thin, watery discharge. Colds cause a runny nose with thicker discharge that may be yellow in color. Fever. Hay fever does not cause a fever. Colds typically cause a low-grade fever. Different circumstances with side effects like hay fever. Head cold. Infective rhinitis incorporates upper respiratory lot disease. Aggravation rhinitis, response to actual changes or synthetic substances. Sinusitis. Not at all like hay fever, these circumstances can likewise cause fever. Hay fever side effects in babies and youngsters. Hay fever is very normal in youngsters, however, they seldom foster before 3 years old. Be that as it may, treating sensitivity side effects, particularly in babies and children, is significant. Serious hay fever side effects can form into long-haul medical issue like asthma, sinusitis, or ongoing ear diseases. Late investigations show that hereditary qualities might demonstrate whether your kid will foster asthma close by hay fever. More youthful youngsters might experience more difficulty managing hay fever side effects. It can influence their fixation and resting designs. In some cases, the side effects get mistaken for the normal virus. In any case, your youngster will not have a fever like they could with the cold, and the side effects will persevere past half a month. What are the drawn-out side effects of hay fever? Hay fever side effects frequently start following you're presented to a particular allergen, having these side effects for beyond what a couple of days can cause. Stopped up ears, sore throat, diminished feeling of smell, cerebral pains, hypersensitive shiners, or dark circles under the eyes. Exhaustion, touchiness, puffiness under the eyes. Encountering these side effects after some time can adversely affect rest quality. Asthma side effects. Personal satisfaction as side effects might make exercises less charming, or make you be less useful working and school, or even expect you to remain at home from work or school. Ear diseases, particularly in youngsters. Eyes, or unfavorably susceptible conjunctivitis, which happens when the allergen disturbs the film over your eye. Sinus irritation, which can become sinusitis because of tenacious blockage. A few patients say that hay fever feels like a cold, particularly in the event that it go on for a significant stretch of time and side effects deteriorate. This reaction causes hay fever side effects. What causes your hay fever sensitivities? Hay fever side effects normally start just after you're presented to the allergen. Allergens can be inside or outside occasionally or extended. Normal allergens include dust, form, or parasites, pet fur or dander, dust parasites, tobacco smoke, scent. These allergens will set off your resistant framework, which erroneously distinguishes the substance as something unsafe. In light of this, your resistant framework produces antibodies to safeguard your body. Antibodies signal your veins to enlarge, and for your body to create incendiary synthetics, similar to receptors. This reaction causes hay fever side effects. Hereditary variables. The probability of creating sensitivities additionally increments in the event that somebody in your family has sensitivities. This study trusted source discovered that assuming guardians have sensitivity-related infections, it builds the possibilities of their kids creating hay fever. Asthma and dermatitis that isn't sensitivity-related don't influence your gamble factor for hay fever. What sets off your side effects? Your side effects might fluctuate relying upon the season, where you live, and what kinds of sensitivities you have. Realizing these elements can assist you with planning for your side effects. Early springtime frequently influences individuals with sensitivities to pollen, yet nature blossoms at various seasons. For instance, tree dust is more normal in the late winter. Grass dust is more normal in pre-summer and summer. Ragweed dust is more normal in the fall. Dust sensitivities can be more awful on hot, dry days when the breeze conveys the dust. Yet, your hay fever side effects might show up lasting through the year, assuming you're sensitive to indoor allergens. Indoor allergens include dust bugs, pet dander, cockroaches, shape and contagious spores. Once in a while, side effects for these allergens can show up occasionally as well. Sensitivity to shape spores will quite often be more terrible during hotter or more damp climate. What exacerbates the side effects? Hay fever side effects can likewise be exacerbated by different aggravations. This is on the grounds that hay fever causes irritation in the covering of the nose and makes your nose more delicate to aggravations in the air. These aggravations include wood smoke, air contamination, tobacco smoke, wind, spray showers, solid scents, changes in temperature, changes in dampness, disturbing vapor. Instructions to treat or deal with your side effects. Home medicines and plans are accessible to assist with diminishing your side effects. You can diminish the possibilities interacting with residue and form by tidying up and circulating out your rooms routinely. For open-air sensitivities, you can a climate application that lets you know what the dust count is, as well as the breeze speed. Other way of life changes include keeping windows shut to keep dust from coming in, wearing shades to cover your eyes when you're outside, utilizing a dehumidifier to control form, washing hands in the wake of petting creatures or associating with them in a breezy space. To ease clog, have a go at utilizing a neti pot or saline splashes. These choices can likewise diminish post-nasal trickle, which adds to sore throats. Treatment choices for kids include eye drops, saline nasal washes, non-drowsy allergy meds, sensitivity shots, which are most frequently given to kids 5 years of age and more seasoned. Cooking or preparing food sources or beverages with turmeric may likewise be viable. Turmeric contains hostile to unfavorably susceptible and normal decongestant properties. Investigations discovered that turmeric smothers unfavorably susceptible responses. Other elective medicines have less proof of their advantages, Yet certain individuals feel a distinction in the wake of consolidating these food sources in their eating regimen. These food sources include shrub butterbur, PA-free, spirulina, capsicum, vitamin C, fish oil. Honey is additionally remembered to assist with decreasing sensitivities to pollen. Those adversely affected by honeybees shouldn't consume natural honey. In the case of nothing else, honey might assist with relieving a sore or scratchy throat. That's it for our video. If you liked the video, please like the video and subscribe to the channel. See you in other videos. Bye!